Our patients recognize more the surgeon's role and not the anesthesiologist's role.
Yeah.
And that's why in our, at least today as our World Anesthesia Day, what we want to lay emphasis on is for people to understand that a very key role in the behind the scenes is actually played by the anesthesiologist. And most patients actually judge the success of the surgery based on the fact that whether they had pain pre-op, pre-operatively, during the surgery, or post-operatively. And this is taken care of by the anesthesiologist. And also, for the surgeon to have a conducive environment for him to work, it all depends on the quality of anesthesia that he's given, because a lot goes into play, not just sedating the patient and making sure that he's painless, but also in maintaining the parameters for the surgeon to have a good environment to do his surgery.
There's a common joke. We say that the presence of the anesthesiologist is only felt when they're absent.
Yeah. Oh, wow.
That is the only time
Which
that
is true.
Yeah.
Yes. Take them away, then you realize they're not there. But while they're there, no one really seems to realize they're there. But the truth of the matter is that the surgical services, and that includes even obstetricians and anything that requires surgery, will always need an anesthesiologist or an anesthetist to be there to take care of the patient, because our role, as she said, is to keep all your parameters okay, ensure that you're breathing fine, your heart is beating well, your brain is getting enough oxygen, keeping you alive during that time.
Yeah.
And then after that, of course, it's again our role to ensure that you're coming back to life. So it bothers us, I must admit, that the role is not recognized, not only by patients, but even by the authorities, the various levels of governments, hospital administrations. They do not seem to appreciate the role that we do play.
Yeah. Well,
Anesthesiology is a field that requires a lot of commitment.
yeah.
And it's very time intensive.
Yeah.
And as an anesthesiologist, you have to be 100% committed to your work.
Yeah.
You can be called at whatever hour for whatever emergency, and you have to be ready to be there to sort out your patient. Yeah. So for that reason, you will not have as many people take up anesthesia as they will do other fields.
Yeah.
Another reason is probably because as an anesthesiologist, you look at a patient in a wholesome manner. Yeah, you're not dealing with just probably the brain or just the chest or just the abdomen. All right, you have to look at a patient in totality. Yeah, so it's a very intense. It's a very intense program. Even in theater in itself, when it comes to taking care of emergencies, it's also very intense. It's adrenaline driven. Yeah, and for that reason, you may not find very many people interested in anesthesiology, but we encourage them that it's a very fulfilling practice. I think and I think Steve will agree with me, is one of the most fulfilling things is when you have a patient who is on the verge of, I hate to say this, but on the verge of death, and you actually sort out that patient from the get-go, and you have this patient walk out of hospital. And what you'll find in our setup is that anesthesiologists are not just in theater. Anesthesiologists are also intensivists. And intensivists are basically the people who will take care of patients in the critical care units as well. Yeah, so we have a very adrenaline-driven practice. But it's actually very fulfilling at the end of the day. Yeah.
Okay, that's good.
We go back to the Bible in the book of Genesis. It's reported, I think it's in chapter 2 somewhere, verse 21, I think, that God put Adam to sleep. If those of you read the Bible, he put Adam to sleep, and then he took out his rib and did something with it, created the woman. The next verse, we are told, and Adam said, it means now he's awake. So from the religious perspective, this is the first record of an anesthesia being done. It means for God to be able to take out the rib from Adam, he had to make Adam sleep and not feel the pain, and at the end of it all, bring him back. And that is basically what we do. So should you, God forbid, that you have to come for surgery, my role is to keep you alive, pain-free, while the surgeons are, we call it assaulting you. They keep cutting you or whatever. So my role is going to be just ensure that you're pain-free, you're alive, and you walk out of that hospital. So should you have to go to theater, your biggest worry should not be who is going to cut me up. It's who is this person who is going to ensure that I am alive and I leave this hospital alive. We are judged on the spot. The surgeon could probably make a mistake or two and come correct it after a year or 10 years or something, but for us, it has to be there and then. So in a nutshell, in the simple terms, that is what we do in anesthesia within the operation room. But out of the operating room, as she said, we run the ICUs, the emergency departments. We are the ones who take care of anyone who needs critical care in this country.
Prior to giving you anesthesia, usually we'll take what is called a pre-anesthetic history. Yeah? So we'll want to find out, have you had anesthesia before? Are you allergic to any drugs? Do you have any other related illnesses besides the one that you've presented with? Yeah, but that is not always. Of course, that's done way before you come to the operating table. Okay. And even before we have this, I mean, before you get to the theaters, we also have to take consent for anesthesia, yeah? Because the same risks and complications that go along with surgery, there are also risks and complications related to anesthesia. So you have to do this prior to bringing you to theater. And when we get to theater, we also try to, relieve your anxiety. So we'll talk to you and try and explain, this is what is going to happen. This is a form of anesthesia we're giving you. Again, just to reiterate what you've already undergone during the pre-anesthetic evaluation, right? Yeah. Then, again, the counting bit that I think most people relate to, whatever you see in the movies, that is just part of... when we're giving you general anesthesia, we're trying to talk to you and titrate the drug up to the point where you're completely sedated. So that's, I think, the bit that most people know based on what they actually see. Yeah?
Small percentage of people in which that can happen, because we are all different in our genetic makeup and how we respond to drugs. So there's a small risk that some people might get to that. But currently, with the technology that we have, we are actually able to monitor your brain activity and prevent that from happening, so that the level of titration or the level of drugs that we are going to give you will just be enough to make you not wake up during that operation. But the risk is there, however small it is, but it is there.
This is our umbrella body under which our Kenya Society of Anaesthesiologists belongs, and we're both members of the society. And the point is to actually bring awareness regarding the human resource factor of anesthesia. The only way that we can talk about having safe anesthesia practices is actually by having enough anesthesiologists in this world, actually as a global initiative, to provide anesthesia. But if you look at the current population from a study that was done by the World Federation of Societies of Anaesthesiologists, it showed that we actually have less than 5 anesthesiologists per 100,000 population. So you can see we are still, even globally, having very few anesthesiologists, and our campaign is to actually try to bring in the policymakers to invest more in getting anesthesia providers, because as part of talking about universal health care and providing the best health care to our populations, you have to bring in the anesthesia bit, which, like you had started, has been grossly overlooked over the years.
Yeah.
In Kenya right now, she mentioned 5 anesthesiologists per 100,000. That is a recommended WHO ratios. But right now, we have 3 anesthesiologists for 1 million Kenyans. What it means is that if you are going to go to labor in Msambweni, for example, and you only have this one anesthetist, because we rely on the CEO anesthetist a lot in our country, who is still held up in another theater. You will have to wait for this to finish before they come and sort you out and help you.
But you're in labor, so you can't wait.
What choices do you have? There's only one anesthetist who is busy with another patient. He's not going to leave that patient to come to you. So to put it into perspective, it means you'll have to wait. And that's why we talk about the increased mortality and morbidity for the mother and the baby. Because the longer you wait, it means your baby is probably getting worse. You are getting worse. Both of you could die because there was no anesthetist. Whereas you have the obstetrician ready and willing to operate, maybe to deliver you by cesarean section. But you have no one to put you either to sleep or to provide the anesthesia for you to facilitate this surgery. So the fact that we do not have anesthetists itself is leading to this kind of situation. And in fact, worldwide, we are looking at a number of about 17 million people dying every year because they don't have access to safe, affordable anesthesia. What, in perspective, that means that lack of anesthesia kills more people than HIV, TB, malaria put together by a factor of 4. 4 times the number of people who die from malaria, TB, and HIV. That is how bad it is. So we are going to continue losing more mothers, more babies, unless as a country we take steps to sort out the anesthesia bit.
One of the mandates as members of the Kenya Society of Anaesthesiologists is actually to develop standards and guidelines, which we share with the Ministry of Health. And these guidelines and standards actually give direction on how many anesthesiologists that we need. We also have done mapping to indicate the current anesthesia providers that we have in the country and what is the recommended number. Again, you have to realize that we don't just have the physician anesthesiologists. We also have registered clinical officer anesthetists, and we have the nurse anesthetists. Yeah? And all this is an effort to increase the anesthesia providers in this country. As a Kenya Society of Anaesthesiologists, we also develop standards of equipment that is needed within the theatre, what is the minimum requirement, and we try and also provide guidelines on the standard of training. Yeah? And all this is in an effort to ensure that we develop enough anesthesia providers who are actually at the same level as, as per the international standards, right? Yeah, so all this is just in an effort, again, as per this current initiative for the World Anesthesia Day, is to try and create enough human resource for anesthesia. And like the numbers that you've been given by Dr. Okelo, you can actually see it's quite a big problem that we have at the moment. Yeah.
Basically, this one I'm directing to the governments, both county level, now that health is devolved, and the central government, that we need to train more. And let's avoid this issue of stopgap measures where you just want someone who can do something for a few days. Let us invest, and for every $1 that we invest in anesthesia, economically, it comes to $10 back to you. And even you as a MediaMax or wherever, if you feel that you could sponsor 1 or 2 doctors from one of the counties to go and study anesthesia, that would be something more than welcome. So I really think we need to focus and invest more, and that way, as an economy, we'll get back what we put in.
Whenever you're coming for whatever procedure, get to know who your anesthesiologist is. Get to know what kind of anesthesia will be administered. Get to learn the risks and the complications that will be associated with your surgery. Get an informed consent from your anesthesiologist. Our efforts are actually to try and demystify anesthesia. Yeah.
Okay.